Hello everyone, welcome to Pharmacy in Our Lives, a pharmacy show sponsored by Guehu Media and Pleasant Care Pharmacy, a locally owned health mart. My name is Dr. ChauPhan. I'm the main host of the show. It's my pleasure to be here to educate the public about different health topics through the perspective of a pharmacist. So sitting with me today is my co-host, Tiffany. Tiffany, welcome.
Thank you.
So she's a first-year pharmacy student from the University of the Pacific. And I wanted to let you know the goal of our show is to encourage viewers to be more aware of their health and wellness by educating on common health topics, drugs, or pharmacy-related topics. Many of the conditions that we will discuss on the show are preventable and can be managed at home if everyone can understand how important it is to comply with treatment, which includes not only medications, but also lifestyle changes as well. So this month we will be talking about a general overview of hepatitis, which is very relevant to the Asian American population, who make up 50% of the 1 million Americans with chronic hepatitis.
So what is hepatitis? Hepatitis is a condition where the liver becomes inflamed and prevents it from performing vital functions in your body, such as digesting food, storing energy, and removing poisons. It can be self-limiting or it can progress to fibrosis, which is scarring of the liver, cirrhosis, which is liver damage from excessive scarring, or liver cancer. Hepatitis is most often caused by a virus. Heavy alcohol use, toxins, some medications, and certain medical conditions can also cause hepatitis. There are different types of viral hepatitis in the U.S. called hepatitis A, B, and C.
So first I'm going to talk about hepatitis A, which is a highly contagious liver infection caused by the hepatitis A virus, also HAV. So hepatitis A still occurs in the U.S. Although it's not as frequently as it once did, there are around 3,000 new cases each year, and many of which are from American travelers who got infected while traveling to parts of the world where Hep A is common. So hepatitis A virus usually goes away on its own with no serious complications. However, it may cause some patients to suffer liver failure. About 100 deaths are estimated a year due to hepatitis A virus in the US. And hepatitis A virus is commonly spread by consumption of contaminated food or water, and improper hygiene after coming in contact with contaminated fecal matter, or like someone who is infected or the caregiver for an infected person, or come in contact with someone who engages in sexual activities with an infected person.
Anyone who has come in close contact with someone who has HAV or who has eaten food or drank water polluted by HAV is at high risk of contracting the virus themselves, especially if they have lived with an infected person, have been a sexual partner of an infected person, have used recreational drugs, whether injected or not, and have traveled to countries where HAV is common. Not everyone has symptoms after contracting HAV. If symptoms developed, they usually appear 2 to 6 weeks after infection and can include fatigue, fever, loss of appetite, nausea, vomiting, abdominal pain, dark urine, gray-colored stools, joint pain, and jaundice, which is yellowing of the skin and the whites of the eyes. Symptoms are more likely to occur in adults than in children and tend to last anywhere from 2 to 6 months.
Because hepatitis A sometimes has no symptoms, it's diagnosed by a blood test to check for a presence of HAV antibodies produced by the immune systems in response to the virus. Now, medications are not used to treat hepatitis A since it usually resolves itself within 6 months. Doctors often recommend you to bed rest or drink lots of fluid, eat a healthy diet, and avoid alcohol during this time. Now, if you are infected with hepatitis A, you must consult with your doctor before taking prescription or over-the-counter medications. vitamins, or herbal supplements, and you need to get checkups regularly to make sure your body has fully recovered.
The best way to prevent HAV infection is to get a Hep A vaccination. It is given in 2 doses, usually about 6 months apart. It also comes in combination form containing both Hep A and Hep B vaccine indicated for 18 years or older, which is given as 3 shots over the course of 6 months or 3 shots over a 1-month time frame with a booster shot after 12 months. Those who should get vaccinated against Hep A include all children at age 1, travelers to country where Hep A is common, people with long-term liver diseases and/or blood clotting disorders, users of recreational drugs, sexual partners, and household members of people with HAV. It is also important to always wash your hands with soap and water before preparing or eating food, as well as after using the bathroom or changing a diaper.
So next, I'm going to talk about hepatitis B. And hepatitis B can be a very serious liver disease that results from the infection with hepatitis B virus, HBV. The majority of adults who get HBV, is about 95%, have it for a short time, up to 6 months, and they actually get better on their own. Now this is called acute hepatitis B. Now the other 5% will go on to develop long-term or chronic hepatitis B, which can later result in cirrhosis or liver cancer. Now your age and the strength of your immune system will determine the likelihood that acute hepatitis B virus will become chronic. Now hepatitis B virus is transmitted through the blood, semen, or other body fluids from an infected person. And this can happen through sexual intercourse with an infected person, and this is the most common way for adults in the US to get infected with hepatitis B. Or you could be sharing needles and syringes with someone infected with hepatitis B virus, or there could be outbreaks from poor infection control. Now, an infected mother can also pass on the hepatitis B virus to her infant after giving birth, and this is the most common way of infection worldwide. Hepatitis B virus is not spread through breastfeeding, sharing utensils, hugging, kissing, holding hands, coughing, or sneezing, so don't worry about those things. But unlike HAV, hepatitis A virus, it is not spread by contaminated food or water.
People have a greater risk of HBV infection if they participate in high-risk activities such as injection drug use and unprotected sex, live or work with a person who has chronic HBV, or in a place with potential exposure to infected blood, such as a healthcare institution, were born to a HBV-infected mother, have your blood filtered by a machine such as hemodialysis, have HIV or chronic conditions such as diabetes, kidney, or liver disease, or travel to countries where HBV is common, such as Africa, Central and Southeast Asia, and Eastern Europe. Like Hep A, many people with Hep B do not have symptoms and do not show that they are infected. If symptoms occur, they can include fatigue, fever, loss of appetite, nausea, vomiting, dark urine, gray-colored stools, joint pain, and jaundice. If symptoms occur with an acute infection, they usually appear within 3 months of exposure and can last up to 6 months. If symptoms occur with chronic Hep B, they can take years to develop and can be a sign of advanced liver disease.
Similar to Hep A, Hep B is diagnosed by blood tests, and there are several different blood tests available that can help you determine whether you have Hep B or not. So you could benefit from getting vaccinated, have an acute or chronic infection, or it can determine if you have recovered from an infection and if you are immune to hepatitis B virus. Now, the best way to prevent infection is by getting the hepatitis B vaccine to stimulate the production of antibodies against future exposure to the virus. And this vaccine is a 3-dose vaccine. The second vaccine is given 1 month after the first dose, and the third dose is given 6 months after the first dose. The hepatitis B vaccine is recommended for newborns, children and adolescents not vaccinated at birth, those with higher risk of HBV infection, as mentioned earlier. Now, if you know you have been exposed to HBV, contact your doctor immediately, and if you haven't been vaccinated, receiving an injection of hepatitis B immunoglobulin as soon as possible may help you protect you from developing hepatitis B, and you can get vaccinated at the same time.
Treatment for Hep B varies depending on whether you have acute or chronic Hep B. Medications are not used to treat acute Hep B. Doctors often recommend drinking lots of fluids, avoiding alcohol, getting adequate nutrition and rest to help your body fight the infection. You should also see your doctor frequently to make sure your body has fully recovered from the virus. Chronic Hep B infection can be treated with medications. In most people, treatment does not cure Hep B. It can only suppress the replication of the virus to slow progression of cirrhosis, which is liver damage, and reduce incidence of liver cancer. There are several oral antiviral agents approved to treat chronic Hep B. World Health Organization, WHO, recommends the use of tenofovir and entecavir. They are the most potent drugs to suppress HBV because they rarely lead to drug resistance, are simple to take with once-a-day dosing, and have few side effects, so only limited monitoring is needed.
So lastly, hepatitis C virus, HCV, that can cause both acute and chronic hepatitis C infection. It is a blood-borne virus transmitted through exposure to small quantities of blood, such as drug use through the sharing of needles and syringes, the reuse or inadequate sterilization of medical equipment in healthcare settings, and the transfusion of unscreened blood and blood products. HCV can also be transmitted sexually or passed from an infected mother to her baby. However, these modes of transmission are much less common. Hepatitis C is not spread through breast milk, food, water, or by casual contact such as hugging, kissing, and sharing food or drinks with an infected person. Acute hepatitis C virus infection is usually asymptomatic, which means that you don't have any symptoms, and is rarely associated with life-threatening disease. About 15 to 45% of infected persons spontaneously clear the virus within 6 months of infection without any treatment. However, the remaining 60 to 80% of persons will develop chronic hepatitis C virus infection that may develop into cirrhosis or liver cancer.
Those who do may experience the same symptoms as Hep A and Hep B, like fever, fatigue, dark urine, abdominal pain, and jaundice. Due to the fact that HCV infection is usually asymptomatic, few people are diagnosed. Hep C is usually diagnosed decades after infection if it becomes chronic and symptoms develop secondary to serious liver damage. HCV infection is diagnosed in 2 steps. First is the screening for anti-HCV antibodies present in those who have been infected with the virus. If the test is positive for anti-HCV antibodies, a nucleic acid test for HCV ribonucleic acid, RNA, is needed to confirm chronic infection because about 30% of people infected with HCV spontaneously clear the infection without treatment.
Hepatitis C does not always require treatment, as the immune response in some people can clear the infection, and some people with chronic infection do not develop liver damage. Now, when treatment is necessary, it depends on several factors, including the strain of the virus and the type of treatment given. So usually antiviral medications such as Sovaldi and Halvandi combination are part of the preferred regimens in the World Health Organization guidelines, and it can achieve cure rates above 95%. So I wanted to really emphasize that hepatitis C virus is curable. Currently, research is still ongoing for a hepatitis C virus vaccine. There is no vaccine for hepatitis C. Therefore, prevention of hepatitis C virus infection depends upon reducing the risk of exposure to the virus in healthcare settings and in higher risk populations. For example, people who inject drugs and through sexual contact. The following list provides a limited example of primary prevention interventions recommended by World Health Organization. First of all, always have proper hand hygiene, which includes surgical hand preparation, hand washing, and the use of gloves. Second is safe and appropriate use of healthcare injections. Third is safe handling and disposal of sharps and waste. Fourth is provision of comprehensive harm reduction services to people who inject drugs, including sterile injecting equipment. Another one is testing of donated blood for hepatitis B and C, as well as HIV and syphilis. And another one is training of healthcare professional. And last but not least is promotion of correct and consistent use of condoms. Well, there you go. We did a quick overview of hepatitis A, B, and C for everyone, and I hope that you find the information useful. Thank you so much for watching Pharmacy in Our Lives, brought to you by Guihung Media and Pleasant Care Pharmacy, a locally owned Health Mart pharmacy. So thank you again to Tiffany for being here. Did you enjoy it?
I did. It was a lot of fun filming this.
Great. If you have any questions or suggestions, please email me at drchaophan@pleasantcarepharmacy.com or call us at 510-200-9984. We have pharmacists and pharmacy students to help answer your questions free of charge. You can also visit me at www.pleasantcarepharmacy.com. Thanks again for watching, and I will see you next time. My son, at 3-month-old, he had really bad eczema. It was all over his face, his body. Sometimes at night, he would wake up and cry, and we would find him covered in blood from scratching himself. I took him to his primary care physician, an allergist, even a dermatologist, even trying naturopathic doctor. And through all those, most of the Western doctors, they prescribed to him steroid cream. And being a pharmacist, I know that steroid cream long term is not good for my son, so I don't want that to be his treatment forever. I tried really hard finding a solution for my son, and I couldn't find anything that really helps him and maintain his eczema. So when I was able to open up my own compounding pharmacy where I can create creams and come up with formulas myself, then I said, well, that's the first thing that I'm going to do. I'm going to try to find an alternative cream that doesn't have long-term side effects that my son can use for a long time every day. So my cream, after I use it on him, he has now improved up to 90–95%. With that in mind, I wanted to help other people that have skin disease and skin problems that just couldn't find that solution.
My acne was very, very bad. It appeared all over my face. My cheek area, my neck, all the way to my back and my shoulders.
Every person, their skin needs are going to be different. So that's why I want to sit down with the patient and find out their problems or what they're looking for and come up with a formula that are specific for their skincare needs.
Child gives you that special care where she'll sit down and spend the time to discover what your needs are and what you want to look like and give you the product that's appropriate for your skincare.
I believe that one size does not fit all, and it shouldn't fit all. There are a lot of brands and there are a lot of products out there. So for me, I believe in simplicity and cost effectiveness.
I have to use at least 5 products per night for my regimen. This is what I got from Pleasant Skincare. There's only one product that I have used to achieve the result I wanted.
I can customize whatever you need into one bottle, and it not only decrease on the amount of products you have to buy, but it also decrease on the amount of money that you have to spend. And it will decrease on the amount of time that you have to spend on your face and your skincare regimen.
I've been using Pleasant Care pharmacy products for about a year and definitely seen the difference.
I like Mommy's cream so much.